these up, so I always forget. And please eat more cake.
Rita wanted me to film for her, so I'm just filming for her.
Thank you. Response.
Beautiful.
Thank you.
Oh, she asked you to record the whole presentation. I think so.
You got it. Oh, is it advancing? Professor.
No, in this lifetime. It's just too tough. We really admire you for that. So, good afternoon, everybody. I'm going to talk about telehealth today. This article by Mayo Clinic indicates that telehealth and telemedicine is a leading trend and topic of discussion in healthcare, in the healthcare industry as well as in general public. What are the challenges that our healthcare industry faces today? One is costs. The costs are going up, reimbursements are going down, and that obviously affects profits. The second challenge is integration of technology, especially that of EHR and AI, because it is now in process. It is very time consuming and takes a lot of effort. And the third is access to healthcare. And the common denominator solution for all these is telehealth. So before we get into the solutions, we need to understand what telehealth and telemedicine is. Telehealth is the use of communication technology over a distance to facilitate care of patients and provide clinical services. The prefix tele, it comes from a Greek word, and that means distance. The first use of telehealth, besides getting advice from physicians over rudimentary telephones, was the transmission of EKG data by a Dutch scientist in 1906. The modern uses of telehealth, of course, include use of audio and video technology to facilitate patient care, patient education, and storage, transmission, and assessment of medical records. Telemedicine is a subset of telehealth and includes remote monitoring by technological devices, use of video conferencing for interaction with patients, and the assessment of their health and need for treatment. So first we come to the challenges that the healthcare industry faces today. The first is cost. Healthcare spending accounts for 18% of the GDP, and that is twice the next highest country. The costs are going up and it needs to come down. Reimbursements are decreasing, and if this continues at this rate, then the industry may not even remain sustainable. A study by Penn Health reveals that telemedicine visits are 25% cheaper than in-person visits, and that probably is because the in-person visits they require more physical space, and if there is a telemedicine, then it reduces the need for staff to facilitate the in-person visits, and to some extent the salaries of the provider in telemedicine is lesser. Also, one of the reimbursement is based on quality. This will continue to be so in the future also, and reimbursement depends on quality. Quality by most payers is defined. One of the criteria for that is quality, and that includes ER utilization and hospital readmission within 30 days by a population within a healthcare system. Telemedicine reduces that substantially. So say for example, there is a patient with congestive heart failure located remotely. The data from a digital device or a scale can be sent to a provider located remotely, and periodic assessments can be made, and if there is a need, then the provider can intervene before the patient gets into crisis, and that helps to prevent an emergency. So even for the patients, the direct costs of hospitalization and ER utilization are very high, and so since this can be prevented, the direct costs are saved. Also the indirect cost of travel to the hospitals, and if time is indeed money, then the time taken to travel to a healthcare facility as well as waiting time for the physician is minimized. So that too helps in saving indirect costs. Telemedicine promotes greater utilization of primary healthcare services, and that helps to increase profits for the providers. So to summarize, the cost, telemedicine helps to decrease costs due to reduced overheads. It decreases direct and indirect costs for the patients. It improves patient satisfaction, which is a quality measure, and that helps to get reimbursement, and also promotes appropriate utilization of primary healthcare services. The study says that the profits increase by 20%. Then the facilitation of EHR integration, telemedicine helps in that too. So in our CHF example, a remote patient monitoring device sends data to a provider, as I mentioned earlier, and the data can be provided to a diverse set of providers across platforms. The providers have to communicate with their EHR system to formulate a plan. In fact, in a way, it encourages and even forces seamless communication, because most of the providers are using EHR. And since the patients are already on video conferencing and they are communicating remotely by digital media, AI uses video analysis and generates all medical information. It captures all risk scores for billing, and remote sensing devices are used to alert providers to relevant fluctuations and suggest medical treatment. Of course, that has to be approved by medical supervision. So the takeaway point is that telemedicine is already operating on digital space, so the integration with artificial intelligence is much easier. And then we come to access. Currently, 1/3 of the American population has reported difficulty in getting access to specialists. 100 million Americans live in primary care shortage areas. The problem, as Timur had discussed in the presentation last week, the problem is mainly of maldistribution rather than the lack of numbers of providers. So in urban areas, if there are 263 specialists per 100,000 residents, in rural areas there are only 30 specialists per 100,000 residents, and similarly the primary care providers are 84 per 100,000 residents in urban areas versus 60 per 100,000 residents in rural areas. So it's a problem more of maldistribution, and so redistribution is the key and telemedicine is the tool. Telemedicine is already occurring, and it is more prevalent where the role of the provider is consultative rather than procedural. So in fields like dermatology, cardiology, and big time in psychiatry, teletherapy and telepsychiatry are big. As we know, we have helplines for that. Just the last year, 30% of the adult population in rural areas reported that they use telemedicine. Also, the integration of telemedicine has helped in increasing patient satisfaction. Our challenge is to foster this change and to ensure the infrastructure for this to grow. This includes fostering the funding of digital infrastructure, establishing business relations across and within health systems, and to continue to address the maldistribution of providers, and also incorporating new technologies that increase the scope of telemedicine. So one of the challenges in telemedicine is that a provider cannot physically examine a patient, and so meet Dr. Temi. So Dr. Temi is a robot that can that can map a facility and be told by a remote provider to go to a patient's room and get the vital signs, and even apply a digital scope, stethoscope to get data. So, how can I, is it by? There's a small video of 1 minute.
This is Dr. Temi, an autonomous robot that is utilized for telemedicine. Temi has an amazing navigation system that includes 16 sensors. It offers endless possibilities for healthcare, hospitality, education, entertainment, and much more.
My name is Mary, and I will be taking on the call in the cemetery, okay?
Temi is about 3 feet tall, attached to 5 direct patient monitor and additional stethoscope.
Please turn on the station monitor and look out into the screen.
It also has different features, including follow me.
Hi, how are you? I'm Dr. Kenny. How are you?
You can connect to Temi through your computer or phone from anywhere in the world.
2 weeks, it will be completely closed, and then we can start getting procedures for you.
Oh, that would be wonderful news.
For more information, visit our website, www.advancedtelemedicinegroupllc.com, and follow us on Instagram at.
Okay, so to summarize, telemedicine has a long history. It decreases costs and increases reimbursements. It helps to integrate various EHRs and artificial intelligence and newer technologies, and increases access to healthcare and addresses maldistribution. So thank you. And